Welcome to this SCAI 2015 video presentation on OCT-guided bioresorbable scaffold implantation and its impact on rates of scaffold malapposition and early neointimal strut coverage. My name is Dr. Joel Giblett. BVS are a novel treatment for coronary artery disease combining the benefits of a drug-eluting stent with the potential for late lumen enlargement and enhanced vasomotion at a late time point. However, some concerns have been raised regarding higher than expected rates of scaffold thrombosis in real-world registries, such as the GHOST-EU registry. In these registries, there was minimal use of intracoronary imaging, which will limit the ability to post-dilate the scaffold and potentially increase the risk of underexpansion and therefore scaffold thrombosis. In our study, we set out to look at strut coverage and neointimal growth, as well as scaffold apposition at an early time point following OCT-guided BVS implantation. We assessed a number of measurements at both baseline and follow-up. These included flow area, scaffold area, neointimal growth area, scaffold apposition, and neointimal strut coverage. Here we see a BVS implanted at baseline. We can see that it's well opposed. We measured the luminal area, which is shown with the pink line. We also measured the scaffold area, now shown in blue, and then finally we measured the strut area. By subtracting the strut area from the luminal area, that gives us the flow area. At follow-up, we can see that the struts are well embedded in the wall and there is significant neointimal growth. Again, we measured the luminal area and the scaffold area. Finally, we measured the strut core area. The flow area is equal to the luminal area, as there are no intraluminal defects seen on this picture. The neointimal growth area is equal to the scaffold area minus the luminal area and the strut core area. We also assessed strut coverage. We calculated the strut as covered if the distance from the abluminal surface of the dark core to the lumen was greater than 150 microns, as seen in image A. In image B, it's less, and therefore we counted that as uncovered. We looked at 29 scaffolds with a total of 1,339 frames. The lesions that we implanted in were complex, with 75% classified as B2 or C. Scaffolds had a median diameter of 3 mm and a median length of 28 mm. And we followed up for a median length of 74 days. Overall, we saw that 117 struts were uncovered at follow-up, which is 2.17%. There was a reduction in incompletely opposed struts from 77 to 26, which is half of 1%, which was significant, and only 9 scaffolds actually had evidence of incomplete apposition when viewed at follow-up. The flow area was reduced by 8.4%, which was significant, as was the scaffold area, which was reduced by 4%. Strut core area remained unchanged, and neointimal growth area was 0.65 mm squared. BVS exhibit modest early neointimal growth when implanted using OCT guidance. Mean flow area was reduced in line with previous studies such as Absorb Cohort B, where mean flow area was reduced at 6 months. Our study shows that routine use of intracoronary imaging allows optimal scaffold implantation, and this may serve to reduce concerns regarding future scaffold thrombosis with this device.